The cardiologist on receipt of that angiogram immediately called me on the phone. He said, Mr. Harwell, if you don't have open heart surgery and you have a heart attack, you're going to die. You know, this is a very, very aggressive procedure. I mean, you saw your chest bone apart. You take veins from your legs and so forth. It's not something that's a free lunch for a man that's 85 years or 86 years old. There are risks. So it doesn't automatically prolong life to have the surgery.
Diabetes, the diagnosis, oh boy, it really turned me around. It really tipped me upside down. It made me think about what did I want? You know, I could have sat down and just vegetated and died. But that's not me. That's not what I wanted. But it really, the things I've learned from it, the healthy things, why didn't somebody tell me about these things earlier in my life? You know, or did people tell me and I didn't listen?
I've been to all different kinds of physicians throughout my whole life. I'd had back pain since I was about 12 years old. And we had tried I've been to orthopedists, you know, neurologists, general practitioners, all different kinds of physicians. And we had tried everything we could try. And finally, it came down to surgery. My orthopedist had sent me through, we did physical therapy, we did electric shock treatments, we did all sorts of things. And we started out with the least aggressive, and we figured the surgery was the most aggressive. And after about 3 years, we decided that the surgery was the thing to do. I had a spinal fusion, and they put 2 rods and 4 screws into my spine. They took a bone graft from my hip and put it in the hospital about 4 days. Came home pain-free, absolutely pain-free. Walking half a mile 3 times a day, and was doing pretty good, way ahead of schedule. Went to my physical therapy, and that's kind of when all my pain started coming back. I wound up with some. They think they pushed me a little too hard, and one of the screws came loose, and some motion in everything that's in, and then the bones didn't fuse together on top of that. So.
You just think about your kids, and you think about seeing them graduate from college and being part of their lives as adults, and that was my focus. I wanted to be there for them until they were old enough to be independent and on their own. So for me, I opted for a mastectomy because I thought it gave me the best health outcome also and the best cosmetic outcome for me as a person, and that was good. It was my choice and my preference, and it was very well respected by the surgeon and the people around me. And then having peace of mind of knowing that chances of reoccurrence and survival were the same, regardless of the decision that I made, whether I had a lumpectomy or a mastectomy, was also comforting.
Well, at the time I was interested in determining the mortality rate of men my age having that kind of an invasive procedure. And so I decided I'd try to get information from various hospitals. So I really posed the question, what's your mortality rate of men 86 years old going through this procedure? And I was assured that not necessarily to worry at 2 of the hospitals. Then I decided to check hospital number 3. And I find myself talking to the leading heart surgeons at that hospital. And he said, well, Mr. Harwell, you realize that this calcification that you're telling me about has taken a long time to develop. And during that time, auxiliary blood vessels have grown that are now feeding your heart. And if it were not for that, you'd be dead. So if your vessels are now providing the need, that is enough of the flow of blood to the heart, that you're getting along okay. Question, why go through the anguish? Why go through the recovery? Why take the risk of having the very invasive bypass heart surgery? And why take maybe 4 or 5 months out of my life during the summertime when I like to play golf to dedicate it to that purpose? Well, again, I think it gets back to deciding whether or not you're going to be in charge of your own health care or whether you're going to delegate it. If you take the attitude that you're going to be in charge, then I don't think it's a problem at all to challenge a doctor if that turns out to be the case, or to ask the questions that in effect become a challenge.
They said a second surgery would only be 70 to 80%, possibility that it would be successful. And it would be 9 days in the hospital, and 5 days of that would be in intensive care. They would start out on the backside of my back, and they would take all the hardware that they had put in the first time out, and they would put all new hardware in. They would do a second bone graft and put it in from the backside. Then they would turn me over. They would take all my insides out and put rods and screws in from the front side and put a whole nother bone graft in. So it would be a whole lot more involved. They said it would take about 14 hours worth of surgery to do it. And the being in intensive care for so long because they had to move so many things around is really a lot that scares you. I saw on the internet advertisement for an opportunity to come and watch some of these different decision making and health videos. And one of them that's helped me a whole lot was informed decision making, healthcare informed decision making. And it opened my eyes up to be involved and question your doctor, because when it comes down to it, it's your body that he's working on, and you need to make the decisions about yourself. And watching those videos put that confidence in me to ask those questions and not be scared of to ask a question. You think of an old doctor that maybe really cared about his patients or did house calls or with the little black bag, and he seemed like he has that kind of mannerism about him. And that means I put a lot of stock in just the way a person treats you. He's told me that I know my pain level, and I know when it's going to be so bad that I come back to him and say, I think it's time to do it. And he's not really pushed me, and he's not, treated me any differently since I decided not to have my surgery.
You have to find people that you trust to help you through this. If you trust your doctor, that's one thing. But if you're in a community where little trust in outsiders happens, you have to find the people in the community that you trust, that you know are going to give you good information, and who are fair-minded and your friends. The thing that I want to say most is that we don't have enough right information coming in the right ways. People expect people to do a lot of reading, and in some communities, reading is not the norm. And you have to find other ways of teaching. We haven't done that yet. We keep putting the brochures out, and they don't work in some communities. In the beginning, my doctor gave me my pills and told me, you have diabetes. Here are the pills, and he let me go. I'll see you in 3 months. I was like, diabetes, what is that? I don't know. He didn't tell me anything. And I went home and I sat down and I started thinking, and I'm like, how am I supposed to have a relationship with this man that is not giving me any information? So I wrote down all my questions, And when I went back to the doctors, I was armed. I knew that I was going to change this paradigm or change doctors. But I wasn't interested in changing doctors because it's too hard. So I said, before I sat down in his office and he was ready to take and do his thing. He said, how are you? And I said, well, I have some questions for you. I said, and why don't we answer my questions first? And then we can get on with the other stuff, okay? And he looked at me, and I guess the way I presented it, that it was more of a challenge to him. And so he started answering my questions. So I wrote down the answers to the questions as he gave them to me. And that started our new relationship.
When I was diagnosed through the biopsy, I was asked to go to the Shared Decision Making Center and watch a film on early stage breast cancer, and to look at different treatment options. And so I looked at the different surgical options, lumpectomy, mastectomy, and what were the outcomes, and what was survival, and what were chances of reoccurrence. And it was very helpful to me to have that information and to see what my options were at that point, because being a woman of not very large breast size, and knowing that my tumor was very close to my chest wall, I was really debating over what would I look like cosmetically after a lumpectomy and what would I look like cosmetically after a mastectomy. So those were the choices I was facing. When I had made my decision to have a mastectomy, I was, in my mind, after watching the films and going to shared decision making, I was very clear that that's what I wanted. When I talked to my surgeon, however, she really recommended that I consider carefully reconstruction. So I went back to the shared decision making center and watched a film on reconstruction. And to be honest, it scared me. It scared me a great deal. I wasn't aware fully of all the complications of the additional surgery and the length of recovery. And I thought, that's not for me.
Walking has probably helped me more than anything, physically and mentally. I can go out and just forget about things, walk along and look at a tree or look at a bird or whatever, and you're not worrying about just the day-to-day sitting in the house looking at the four walls watching traffic go by. You can forget about those kind of things for a while, and if you move around, the pain kind of goes away a little bit. It's helped me with making decisions, influencing my mother or my family about making decisions, that you don't just sit back and have somebody tell you everything. You need to ask questions because it's your body that you're making the decisions about.
I believe I was sitting on my couch when it happened, and it dawned on me, Loretta, this is you. You're going to take care of yourself. You're going to make this work. It wasn't going to beat me. I was going to beat it. And as soon as I said that, my whole world flipped. Because then I decided I had life. And I could live. And I was going to live.
I feel that I have better trust in my care team. I have a very healthy, positive attitude toward my breast cancer. I'm lucky. I feel empowered. I made the decisions that I made, and I think, I'm a happier person. I have a nice, fulfilling life because I was able to choose what I felt was important.
I have to think in terms of the preacher in Vermont. On Sunday, he says to his flock, he says, everybody want to go to heaven, stand up. A little old lady in the front row doesn't stand up. He says, what's the matter with you, Aunt Mary? Don't you want to go to heaven? She said, well, not today, I don't. I got company. Well, I said, well, I've got company,